All right, today we're pulling back the curtain on one of the most important safety checks in the entire pharmaceutical industry, media fill validation. I mean, have you ever wondered how drug companies know that the medicine you're getting is perfectly sterile? Well, if you have, you are in exactly the right place. Let's get into it. To really get why this whole process is such a big deal, let's just start with a simple question. Picture this. You're in one of those super clean, sterile labs making injectable drugs. What do you think is the single biggest, most unpredictable risk for contamination? Now, your first thought might be the machines, right? All those complex pumps and high-tech filters. But honestly, modern equipment is incredibly reliable, incredibly sterile. So, nope, that's not it. The real answer? It's us. It's people. Yeah, even when we're decked out in all that protective gear, we are the #1 source of potential contamination in a sterile process. Just think about it. One tiny mistake, a single stray particle, and an entire batch could be compromised. And that really gets to the heart of the problem. You know, you can have the cleanest room in the world, but the people working inside it are, well, they're human. We're constantly shedding microorganisms. So the entire system of making sterile drugs is built around managing this one fundamental risk. So the big question is, how do you even test a system that's designed to account for human error? I mean, you can't just cross your fingers and hope for the best, not when patient lives are literally on the line. What you need is a dress rehearsal, a full-scale, no-holds-barred dress rehearsal. And that, my friends, is exactly what media fill validation is. It's a perfect simulation of the real manufacturing process, from A to Z. But here's the clever part. Instead of using the actual, often very expensive drug, they fill the vials with this special, nutrient-rich liquid, a growth medium, that is basically a feast for any microbe that might have snuck in. Seriously, that dress rehearsal analogy is the perfect way to look at it. Before the big show, making the medicine that actually goes to patients, you run through the entire performance with a stand-in, making sure every single person and every single step in the process is absolutely flawless. And what this really does is give everyone confidence. See, the whole point of a media fill isn't just about ticking a box or passing some test. It's about proving, with hard evidence, that your machines, your staff, and all your carefully planned procedures work together perfectly to make a safe, sterile medicine every single time. Okay, so how does this dress rehearsal actually play out? Let's break down this step-by-step process. So the process uses this special nutrient broth. It's a bit of a mouthful, but it's called Soybean Casein Digest Medium. And the reason they use this specific stuff is simple. It's like a 5-star all-you-can-eat buffet for a huge range of bacteria, yeasts, and molds. If anything unwanted is in there, this broth will make it grow and become visible. The whole thing really boils down to these 3 critical stages. First, you've got the media selection, which we just talked about. Then you run the realistic simulation itself. And finally, there's a waiting and watching period called incubation. And I have to stress, this is not just some simple, easy run-through. For this test to mean anything, it has to be realistic. In fact, they intentionally incorporate worst-case scenarios. They don't just simulate a perfect day, they simulate a tough day. We're talking shift changes, planned machine breakdowns, cramming the maximum number of people into the clean room, and performing the most complex manual tasks. They are literally stress testing the entire system. Okay, so once all the vials are filled with that nutrient broth, they go into incubation. And this is actually a 2-part process. For the first 7 days, they're kept at a cooler temperature, right around 20-25 degrees Celsius, which is just perfect for any mold or yeast to grow. Then, for the next 7 days, they crank up the heat to 30-35 Celsius, which is like a tropical vacation for bacteria. By doing it in 2 stages like this, they make sure they can catch pretty much any type of bug that could have possibly gotten in. All right, so you've done this intensive 2-week test. What does a passing grade even look like? Well, let me tell you, the standards are unbelievably high. The number they're looking for? 0. That's it. 0 contaminated units. If even one of those vials turns cloudy or shows any sign of growth, it's a fail. Because in the world of sterile manufacturing, perfection isn't just a goal, it's the standard. Now, while the goal is always a perfect 0, the official regulations do have some specific cutoffs depending on the batch size. For a smaller batch, say under 5,000 units, It's a hard zero, no exceptions. As the batches get bigger, like over 10,000, one single contaminated unit is enough to trigger a massive investigation. Two contaminated units, you have to do the entire validation all over again. The main point is, even one failure is a huge deal and is never, ever ignored. But what happens if the test does fail? Does the whole company just shut down? Not at all. A failure is actually one of the most valuable learning opportunities in the entire process. The second a media fill fails, it kicks off something called a root cause analysis, or an RCA. Think of it like a detective investigation. The whole point is to figure out exactly what went wrong, where it went wrong, and most importantly, why it went wrong. And when I say thorough, I mean thorough. They scrutinize everything. Was there a flaw in someone's gowning technique? Did a critical HEPA air filter fail? Was a specific manual step performed incorrectly? Or hey, what about sanitization? Maybe they used the wrong disinfectant or didn't leave it on long enough. They dig and dig until they find that single root cause so they can fix it for good. And this really brings it all back to the people, doesn't it? Because effective training isn't just about procedures. It's about having the right mindset. There's this fantastic quote from the source material that really hits home. It says that staff should be told they are not just handling media, they are saving patients' lives. Wow. When you frame it that way, a routine task is transformed into a critical responsibility. Ultimately, media fill validation really embodies this philosophy. Quality isn't something you just do once. True safety comes from building strong, repeatable habits and systems that are proven to work time and time again. That dress rehearsal ensures the final performance is a life-saving habit. And that leaves us with a final thought. This idea of a full-scale simulation, a dress rehearsal, to prevent a catastrophe is just brilliant. We see it everywhere, from pilots in flight simulators to emergency drills for firefighters. So I'll ask you this. Where else in our world is the dress rehearsal the absolute key to success when the stakes are highest? Something to think about. Thanks for joining me.